This was a sort of collaborative retrospective study, again collecting data on use of CD19 targeted CAR T-cell therapies, including but not restricted to T-cell or Leukemia. And this was because in the Eliana study, you had to have bone marrow disease essentially to be able to receive the product. And so it's unclear what the outcomes would be for patients who had CNS disease as a main site of disease. And this was looking at patients who had either CNS disease as the indication for their treatment, or who actually had active CNS disease at the point of delivering the CAR T-cell therapy. And then it was to look at the toxicity profile and the outcomes. And again, because this was more than one CAR T-cell product, there were slight differences between the delivery of a CD28 containing CAR T-cell product compared to a 4-1BB containing CAR T-cell product, such as Leukemia. But broadly, it was a good intervention with good outcomes, and the toxicity profile, though slightly different between those two different CAR T-cell products, was still favourable and would support proceeding. Ideally, we would like to have that data out for review and for scrutiny, because in some countries it's not possible to deliver CAR T-cell therapy for patients who only have CNS disease as their main burden of disease. However, this is an unmet clinical need. We know that CAR T-cells can be effective in clearing CNS leukemia, and therefore it was very important that at an early stage we've put out as much data as we can to support the use of CAR T-cell therapies targeting CD19 for this important indication, because otherwise in some countries they don't have access to CAR T-cell therapy at the moment, and those patients therefore are particularly where they have post-transplant relapses, don't have any further therapy that can be offered.